Okay, we're going to go on with our second guest today, Yishai Knoble. He's the CEO and co-founder of Helparound. Yishai, how are you?
I'm doing well. How are you?
I'm very good. So tell us a little bit about your company, Yishai.
Absolutely. We're a digital health company, and we focus on a sector that is booming in the therapeutic space, and that's called specialty pharma. And what's unique about this space is that uh, unlike many conditions where you have many people who are dealing with lifestyle related diseases, specialty therapeutics targets those conditions or those diseases that are typically genetic, rare diseases, the smaller populations. But the interesting piece is that while the populations are so small, specialty drugs, and what I mean small, I mean less than 2% of prescriptions.
Mm-hmm.
That's a very small portion of the market. Specialty drugs share almost half of total drug spending in the U.S., which is about $155 billion. So think about it again. Less than 2% of prescriptions, almost half of total drug spending. This means that every patient is using drugs that are very expensive, cost a lot of money to the patient, to the insurance companies, to the government if it's covered by Medicare, Medicaid, and that's a very unique sector where a lot of money is being spent.
So
Now,
where does your company come in to assist these patients?
so basically what we identify is that because these conditions are so complex, for example, multiple sclerosis, epilepsy, ALS, cystic fibrosis, cancer, of course, these are life-changing conditions. And they change the family's life forever. And there's a ton of juggling that is required on the patient and the family. Now, the patient is not set up for that. The patient has got this diagnosis that is changing everything upside down, and they are just getting phone calls from not just the doctor, but from the representative of the pharma company, from the specialty pharmacy, and then from the payer. And that's a very bad solution. A patient that is worth so much money and deserves so much help by the industry should get a better experience. And that's where we come in. What we do is help all these stakeholders, the manufacturer, the specialty pharmacy, the payer, support the patient in a way that improves how they navigate this life-changing condition. And we do that by providing a mobile platform that basically takes existing resources, patient support resources, and adapts them to that specific patient need.
Is it similar to a CRM for the end user, for the patient?
That's a really nice analogy. And while the stakeholders have their own CRM, the patient does not have a CRM. Frankly, the patient is also not looking for a CRM type of experience to be sitting in front of a dashboard and start managing all their tasks. They do have a lot of tasks. They need to manage their pharmacy refills, the insurance coverage, the doctor appointments, transportation, community, caregivers, financials. They have a lot to manage. But a patient wants to live her life, and the family wants to continue living life. So mobile is not only the best place to streamline all that process for the patient, it's also the place that is going everywhere with the patient and allows us, people who come from the world of technology and target and user targeting, to identify based on the behavior, based on the movement, based on locations of the phone, try to come up with the best resources for the patient in real time.
And Yishai, and I hope I'm pronouncing your first name correctly.
You are. Actually, I was impressed. Thank you.
Yishai, have you had a personal experience with a patient in your own personal life? Is that how this business idea came about?
I actually came from a company in the space of type 1 diabetes. I was the head of mobile for a company that developed the first connected glucose monitor, a company out of Boston. And what I actually did not have a personal connection to it, but once I started working in type 1 diabetes, and I am emphasizing type 1 diabetes, where the burden on the patient and the quality of life is very high, there's a lot of juggling to be done. I fell in love with that patient community. I saw people who are empowered by a condition, by a life-changing disease, and instead of coming down with it, or feeling depressed, it was so empowering. And I said, you know what? These are the people that I want to spend my next company on. I want to work with these people because they are such an impressive, loving, and supportive community that for the fortunate people like myself, that's my inspiration. And I chose to work with them. I actually did not come there because of a personal situation.
Well, I want to talk to you about that some more when we come back from our break. Again, we've been talking with Yishai Knoble, CEO and co-founder of Helparound. Stay with us. Welcome back to CEO Money. I'm your guest host, Grayson Armistead, and we are visiting with Yishai Knoble, who's the CEO and co-founder of Helparound. Yishai, for our guests that are just tuning in, just tell me briefly again what it is that your company does.
Sure, absolutely. So we focus on specialty therapeutics, where there's a lot of juggling done by patients and a lot of stakeholders that are reaching out. Especially pharma is on its way to be half of all drug spending. And what we do is provide a mobile patient data platform that allows the stakeholders like pharma, pharmacies, payers to adapt the support programs to the unique characteristics of every patient segment.
And what are the benefits of the platform?
So from the point of view of the patient, of course, it streamlines everything. It's less overwhelming. They get the combination of therapy-specific support, but also a general disease support from the community, from other patients, from nonprofits, etc. So we bring it all together for the patient, for the entire family. From the point of view of the pharma companies, they have spent millions developing different patient segments. They're saying, for this injection, that a growth hormone, for example, that a patient needs to administer at home, we have this persona. There's one segment of adult males, one segment of caregivers or stay-at-home moms who take care of a child. We have someone with absenteeism issues, sleep issues, but then after they did all that work, they end up providing one set of web pages and brochures to support everyone. So this means that, first of all, they don't know who is actually using their support program. They don't know what they're missing out in their help to patients to use the therapy successfully. These are difficult therapies to use. Injecting something at home to a child is difficult. It's overwhelming. So we're giving them a way to reach out to the patient, give them a way to identify who is actually using this therapy, what kind of person, what kind of segment do they belong to, and then adapt their content and deliver it to every patient segment in a way that makes sense to them.
And, that's so important. And for those of our listeners that have gone through any type of a long-term condition, and I've been exposed to that myself and had my in-laws go through these type of challenges, and it is disruptive in your life. And it sounds to me like your company is providing a real service in making their lives a little bit normal in the face of, sheer adversity.
Absolutely, and I appreciate that. And I think it's also important to realize that for the most difficult life-changing conditions, There's this mayhem around the prices of drugs, but you got to remember that there's a lot of resources, a lot of stakeholders, a lot of people involved in making sure that the patient actually gets the drug and successfully stays on the therapy. And while there's a lot of criticism on the incentive, in the U.S. healthcare system, in this case, the incentives are actually really well aligned with the patient. The patient wants to succeed on the therapy. The pharma wants them to succeed on the therapy. The payer wants them to succeed on the therapy. And the pharmacy wants them to refill their prescription. So look at that as a win-win in one of the most, in the fastest growing, most expensive, most valuable segments of the U.S. healthcare market. And I think that's something that needs to be acknowledged in between all the criticism that is put out there as well.
No, and I appreciate your comment, and you're absolutely on point with that comment. So what's coming in the future?
We are looking at more and more conditions. We just completed a very successful trial or pilot with in the space of home dialysis. So if you imagine a company or if you imagine patients who have to do dialysis in the clinic and they have to go 3 times a week, sit there for 3 hours, that really burdens their quality of life. So this incredible company out of Boston called Next Stage Medical invented a therapy that allows them to go and do this dialysis treatment at home, sometimes even while you sleep. So you don't have to spend 3 days a week, 3 hours each time in a clinic dialyzing. What we do is allow them to provide that patient support to the different patients and caregiver, because doing dialysis at home is really scary and really overwhelming. But if you get it right, you win. The family wins. You get to spend most time with your family. And what our role is to make that support more streamlined and make the patient succeed on that therapy.
Well, thank you so much for your service, and I know our listeners that have gone through this are appreciative of what you're doing too, and I wish you all the success. Thank you for being on the show, Yishai.
Thanks for having me. Bye-bye.